Hello, and welcome to our Horizon series. We started this series to help the Ontario livestock sector deal with the big things. The things that will have massive impact on every livestock producer, and in fact, the entire livestock value chain. Each webinar is complemented with a white paper, which you can find on our website, livestockresearch.ca. We really appreciate the strong support we've had and received from leading experts in presenting these topics. We hope you have lots of questions. Please use the Q&A function to get these to Jean Howden for discussion following the presentation. And now I'll ask Chloe Neudorf, our research assistant, to introduce today's speaker. Enjoy the session.
Thank you, Mike. Today, we are pleased to welcome Dr. Heather Murphy, Associate Professor and Tier 2 Canada Research Chair in One Health in the Department of Pathobiology at the Ontario Veterinary College. Dr. Murphy is a contributing editor to the 4th white paper on One Health and is here to speak on that topic. Dr. Murphy is experienced in water and wastewater treatment, water quality, risk assessment, and waterborne disease. Her international experience in Cambodia, Mali, and Madagascar, working on water treatment, sanitation, and hygiene, caters to the nature of One Health, the area she now works in. Dr. Murphy is a Canada Research Chair in One Health, combining microbiology, engineering, risk assessment, and epidemiology to better understand enteric pathogens and transmission pathways in the environment. Her and her research team hope to further understand the burden of risk associated with waterborne disease. Dr. Heather Murphy is LRIC's One Health expert.
Thanks, Chloe, for that introduction. And I'm just going to get my slides up to share with you all. I'm really pleased to be here today. Thank you to LRIC and Mike and Chloe for helping put together this white paper and asking me to be a part of it. As Chloe said, I'm a professor at the University of Guelph. I'm relatively new to the university. I started in September in the midst of the pandemic, but I did do my PhD years ago at the university, so I'm not a stranger to the University of Guelph. So I'm going to spend some time talking to you about One Health. It's kind of this new buzzword maybe you've heard going around, and maybe you've been wondering what exactly do I mean by One Health and what is that? So kind of more simply stated, One Health is a collaborative effort of multiple disciplines working together to improve the overall health of the planet. And by that we mean animal, human, and environmental health. And so if you think of it as kind of two-pronged, one is that we have all these disciplines working together, and then two is kind of trying to tackle problems accounting for the interactions between animals, humans, and the environment. And so you often see this kind of triad of circles that you kind of represent what One Health is. And if you can kind of see my cursor, we want to get in this sweet spot where really we're working at that interface where the three interact. When we think about disciplines that work in this space, we have a lot of different folks. So there's veterinarians, biologists, for example, engineers, microbiologists, economists, policymakers, doctors, social scientists, public health professionals, and then obviously producers. I haven't listed all professionals that work in this space, but it kind of gives you a picture of kind of the teams of people that should be involved in tackling some of these One Health issues. And myself, I wear kind of this engineering microbiologist hat and public health, and I've really worked in the kind of more environmental health human space. And now that I've joined the University of Guelph, I've been transplanted in the vet college, and I have very little experience in animal health, but I am thrilled to be kind of part of it and to think of these problems more from the three areas and pillars of One Health instead of just residing mostly in this space. So why does One Health matter to the livestock sector? Well, a One Health approach is really critical to providing a safe and healthy supply of Ontario meat and dairy for consumption. It can help reduce transmission of infectious diseases, which I'm going to talk about today in my presentation. It also can help avoid the development of antimicrobial resistance, or AMR, while maintaining good health of animals and farm workers. And I'll speak a bit about that as well. And lastly, you can help address the impacts of production on the environment and wildlife residing in close proximity to farms. So moving on to the reduction of emerging infectious diseases and how One Health approach can apply to that. For those of you who aren't familiar, 60% of emerging infectious diseases in humans have come from animals. And these diseases we often refer to as zoonoses. So they're diseases that can be transmitted between animals and humans. So they can go from humans to animals and from animals to humans. Sometimes they only go in one direction. Sometimes they cause illness in both populations of humans or animals, or sometimes they're just transmitted and then can be passed along in those animal or human populations. And so how are these diseases spread? Well, there's a lot of different transmission routes. So we have direct contact, so direct contact with livestock or in between people. Indirect contact would be contact with feces or biological fluids like saliva, and if you sneeze, nasal secretions and things like that. There's vectors, so fleas, ticks, mosquitoes can all transmit some of these zoonotic diseases. And then there's food and water, which often fecal material that gets in contact with food or water are the primary transmission routes for these zoonotic diseases or zoonotic pathogens. So obviously a timely example of an infectious disease that has recently emerged is SARS-CoV-2. And really it exemplifies kind of what a One Health approach should be to tackle this virus. Currently, the exact origin is really being debated in the media and by scientists around the world. And I pulled this more recent article in Nature that says, after the WHO report, what's next in the search for COVID's origin? Although the origin exactly is unknown, it is likely wildlife, and bats are a potential source. And what we do know, regardless of its origin, is that it can be transmitted to animals. So there has been transmission to minks, cats, ferrets, monkeys, and apes. And I've also been told by my colleague last week that it can be potentially transmitted through water into aquatic mammals. So they're seeing in places where there's high contamination of COVID and wastewater getting discharged into waterways that these mammals are actually getting infected with the virus. Another example of some infectious diseases that are relevant and spread between humans and animals are influenza viruses. And typically in humans, we see H1 through H3 viruses circulating from human to human, but there's many different types of subtypes that are spread within animals and then between animals. So influenza viruses are actually quite complex and circulate through all sorts of populations. And what we're finding is increases in poultry and swine populations have been associated with an increased frequency of zoonotic influenza virus infections in humans. So what's happening is some of these viruses are moving from, say, poultry or swine into humans. And although the humans they're maybe getting sick, they're not transmitting it to one another. But the fear is that maybe there'll be a variant that will come out that will then make it so that humans can spread the virus they get from the animal back and forth within human populations. Also with influenza viruses, we're finding that contact between wild and domestic birds and pigs are facilitating transmission, adaptation of the virus, and amplification, which really does increase the risk of a pandemic variant could emerge, which would cause another pandemic like the SARS-CoV-2 because the human population doesn't have immunity to these new types of viruses. Moving away from viruses, another group of organisms that are of interest, zoonotic interest, are bacteria. Campylobacter jejuni is an example of a bacteria that is found naturally in the intestines of poultry, cattle, swine, rodents, wild birds, and household pets. It can be found in untreated ground or surface water that's likely linked to fecal matter in the environment and manure, which could be from human or animal feces. It is a common cause of foodborne and waterborne disease in Canada, and it's actually the #1 cause of foodborne disease, according to Public Health Agency of Canada. And the sources are really raw or undercooked meat like poultry, beef, pork, and lamb, raw milk and other raw dairy products, raw vegetables, shellfish, and then untreated drinking water. And so why does this really matter? Well, for those of you who aren't that familiar, the burden of enteric disease, so diseases that cause acute gastrointestinal illness in Canada, are estimated at around 20 million cases a year by the Public Health Agency of Canada, which is pretty significant. And they think about 4 million are linked to foodborne illnesses. And then if we look at waterborne disease, and I worked at the Public Health Agency of Canada several years ago, we produced some estimates of what we thought the disease burden was associated with different drinking water sources. And we estimated that around 100,000 cases of acute gastrointestinal illness per year were associated with drinking untreated well water or surface water. So really small kind of rural water supplies. And that was due to exposure to Giardia, Cryptosporidium, Campylobacter, E. coli 157, and norovirus in those water supplies. And for those who aren't as familiar, the first 4 organisms I listed there are zoonotic, and so they have animal origin and they can be found in humans as well. Whereas norovirus is a virus that's unique, pretty unique to humans and would be from human waste as opposed to animal waste. And so that kind of leads to a little bit the work that I've been doing in the One Health space and kind of how I've been tackling some of these problems. So from an animal health, I work on enteric diseases that can be spread from animals through the environment and make their way into water. But I also look at ones that are spread from humans that make their way into the environment and then into water. And I'm going to give an example of I work a lot in private well water supplies, but also surface water supplies that are used for either drinking or recreational water. And we see a lot of livestock manure or livestock feces or even domestic animal feces that can make its way into groundwater wells and also into different surface water supplies. But it's not always livestock that's the issue. We also have septic systems that can leach human fecal material into wells. And the more we see these subdivisions coming up in rural or peri-urban parts of, say, Ontario, we're having people with a septic system and a well side by side, and essentially people are drinking their own sewage. So it's not just animals that are a source of contamination. And an excellent example of this is work from my colleague in Wisconsin. So I work with a microbiologist named Mark Borchardt, who works for the US Department of Agriculture as a microbiologist. And they conducted a study in Wisconsin in Kewaunee County that was pretty political, where producers were being accused of contaminating private wells. And then the producers were then accusing households that it was their own septic systems that were causing the issue. And what they found was there was fecal microorganisms found in 60% of wells sampled, which raised concerns about dairy manure and septic waste. And what they found was it depended on the time of year. So at certain times of year, the dairy manure was the source of the contamination, whereas other times of the year, it was septic system waste. And the way they did that is they used these fecal microbial markers, let's say, we call it microbial source tracking, where it's like organisms that are unique to the gut of animals or unique to the gut of humans, and they trace back the source of contamination. So they could say pretty definitively where the contamination was coming from. But from a One Health perspective, say we addressed the issue in Kewaunee County of dairy manure, we'd still have septic system waste. So we have to look at the whole picture and all the different sources and can't just address one piece of the problem. And this is also a challenge for, I think, for producers, like what is the water quality for your livestock? And are they then being infected with pathogens also that could cause impact on their production and their ability to gain weight and be healthy animals? So the next area of One Health I wanted to just touch on is reducing antimicrobial resistance. So it's a very clear area where a One Health approach is warranted. I know LRIC had an expert speak a few weeks ago on AMR, so I'm not going to spend a lot of time talking about that, but if you're really interested, you could refer to that webinar. But antimicrobial resistance is really one of the top 10 public health challenges we face globally right now. And it's estimated that drug resistance could kill around 400,000 Canadians by 2050, and that it's already costing the national healthcare system $1.4 billion a year, which is pretty substantial. And One Health and antimicrobial resistance are really inextricably linked. Because antimicrobial resistance moves between humans and animals directly and also through the environment, we can't just look at them from one perspective. So if we look at antimicrobial resistance only from one of those three pillars of One Health, we really won't solve the problem. So if we address reducing antimicrobials in the human population, but don't look at what's happened in the environment or what's happening in livestock, well, that's not going to solve the issue. Or if we only look at livestock and humans, but then we don't look at what's still in the environment that we haven't removed, we're not tackling the full issue. So it's really quite complicated, and it does require multiple disciplines and perspectives to solve. So I've got a few slides about a project that I've just started working on this summer. It's a pilot project we're about to embark on, and I've kind of put a One Health approach to addressing AMR ? Because we're not exactly sure. But the goal of our research is to look at rotational grazing and see in in beef cattle. And we want to see, can rotational grazing improve soil health while also improving animal, environmental, and human health by reducing the presence and quantity of pathogens in livestock, reducing the need for antimicrobials, and subsequently reducing the need for reducing the presence of pathogens and AMR pathogens in receiving soil and water environments. And so what are we trying to do exactly? So from this animal, environmental, human health perspective, what we're trying to look at is, do we see pathogens being excreted by animals, and are they carrying antimicrobial resistance, or are these animals containing antimicrobial resistance genes, and are they making their way into the environment, so soil and water environment, and then could that be an issue for human health? Also, we're looking to see if they're going into being excreted by animals through the environment. Could they be an issue for animal health? And so on our team, we have a soil health and grazing expert, water microbiologist, which is me, I wear that hat, soil microbiologist, engineer public health expert, that's also the other hat I wear. We have an antimicrobial resistance expert. We have producers, and then we also have a ruminant vet. So we really tried to come up with an interdisciplinary team for this project. What our pilot study looks like, we're going to study 2 rotationally grazed and 2 conventionally grazed beef farms. 2 are in Brant County, so there'll be 1 rotationally grazed and 1 conventionally grazed in Brant County, and 2 in Wellington County that are set up the same way in close proximity to one another so that their environmental kind of characteristics are similar. What we're going to do is compare the presence of pathogens, so those enteric organisms, and if they're antimicrobially resistant organisms, and also those genes in fresh cattle feces. So we're going to look at fresh cattle feces from the perspective of the animal health and what's making it into the environment. Desiccated feces, so what happens when the livestock defecate on the land, and over time, what kind of die-off do we see of those organisms and of those antimicrobial resistance genes? What are we seeing in the soil? And then what are we seeing in the nearby surface water as well as groundwater on the farms? And we're also going to compare carbon and soil health between the different farms over the course of the study. Now, with that, I've just got 2 last slides on what could be done from a One Health perspective on farm. So what could you do if you're a producer? These are some things that Mike and Chloe and I came up with. So one is develop farm level health plan that accounts for livestock, workers, the environment. So that means water and soil and wildlife. What about taking mental health of family and workers into account as part of your health plan? Ensure good biosecurity practices. Implement proper vaccination programs, keep good records on health and movements, ensure proper use of antimicrobial drugs, reduce use where possible, and ensure proper disposal of excess and empties, proper manure and dead stock management, and then trying to implement farming practices that improve soil health and protect soil and water supplies, such as regenerative agriculture, rotational grazing, no-till, for example. and also participating in interdisciplinary research. With that, I'll open it up for questions. Thank you very much.
Thank you very much for your presentation, Heather. Don't have a lot of questions in right now. One of the, just a general overarching. So with a One Health approach, can we prevent the next pandemic?
Yeah, that's a good question, Jean, and pretty hard to answer. I would say if the next pandemic came on the heels of this one, maybe not. I do think at this stage, the focus has been really on the human health side of things and less on the animal health side of COVID. And I think that is still being a bit neglected. So I think we can improve on our One Health approach to the current pandemic. And I think that we're starting to shift. I do think if we implement it properly and we're thinking and doing control from all angles and looking at preventative measures, that yes, in theory, we should be able to prevent that next pandemic. But I think we're still focused very much on kind of individual human health, and we're missing parts of the picture, even on the environmental and animal side, which is unfortunate.
So I guess that kind of back to big and overarching is that they always say, when you've got an elephant, you eat it one bite at a time. And if I look at One Health as the elephant, that is there something you looking at the whole picture, you think here's the first bite that could have the biggest impact?
Yeah, that's a great question, Jean. I think the biggest bite is kind of this paradigm shift in our thinking and not thinking about it just from one perspective. Like myself, I've focused on water. And if I only focused on the water and the environment aspect and didn't look at human health and animal health, I'd be missing a big piece of the pie. So I think if people start to shift their focus and think about all three at the beginning of the problem, as opposed to kind of piecemeal incorporating them in after the fact, that would make a big difference in just the way we go about even thinking about these problems.
Can't ask for a better answer than that. But it still makes it's big and it's a challenge, but we need to start tackling it.
Yeah, I agree.
So I've got a question here. It's many diseases don't care what livestock species they find as a host. How can Ontario livestock sectors work together to find common protection?
That is a really good question. I suppose
we can let you think about it. And the one thing we do, we record the presentation, and any of the questions that aren't answered, we provide them in the feedback at the end of the recording. So if you want to think about that one and give us an answer, we can provide that out to everybody when we send them out the link to the recording.
That sounds good. I think I could take a crack at it. I do think the livestock sectors could work together in terms of reporting of illnesses, and I think there's some surveillance going on, though, like at the provincial and federal level. And so I think linking up with some of those authorities that are already doing surveillance and making it aware of which organisms are the ones most likely circulating right now. And if you were to go and do testing of your livestock for certain organisms, well, which would be the ones you would even bother, and then like reporting that information out. So I think the kind of back and forth, depending on the practicality and obviously affordability of doing so, but that kind of open transparency of surveillance and reporting things into these ongoing surveillance systems that are going on. Particularly like from the AMR perspective, there is surveillance going on antimicrobial resistance, maybe less so on the actual diseases.
Do you feel programs like the Environmental Farm Plan, Ontario Corn-Fed Beef Program, the Verified Beef Plus program help farmers through good practices to that will have an impact?
Yeah, I am not as familiar with those programs yet, but I have been looking at the Verified Beef Plus program, and I've looked at all the criteria, and I do think that those are really good practices. I looked a lot at the ones that seem more relevant to One Health, and I do think that's moving in the right in the right direction. So I do think that those are good practices, and kind of striving to achieve those standards as producers is really a great step in the right direction. But I can't comment on the other programs. I'm not as familiar yet.
Okay. To what extent does AMR apply to viruses as opposed to bacteria? We think of AMR as references to antibiotics.
Yeah, and it's predominantly antibiotics. I suppose we could have like resistance to antivirals at one point, but I think the predominant worry that we're looking at is antibiotics. So that's bacteria. So we have these three major groups of organisms that affect livestock, at least like enteric diseases, like so Cryptosporidium and Giardia are protozoa. And so those are different, and we don't use antibiotics to treat those, but like Campylobacter, E. coli, Salmonella, we use antibiotics for those. So those are the ones that we're most concerned about resistance. But it is possible that antivirals, we could have resistance in the future to antivirals. But yes, the focus has been more on the bacterial. That's a good question.
Are there policy implications related to One Health? For example, should there be more research directed to this whole approach?
I am very biased, so I would say yes, there should definitely be more research directed in that approach. And I have to say, from a researcher standpoint, it's extremely hard to get this work funded. And as much as I want to like put in this One Health research proposal, I've now recognized that I'm still going to have to parse it out to the different agencies and say, I'm only going to do the environmental part on this side. I'm going to do the animal part on this side. I'm going to do human health on this side. And then it's up to me to piece all those funding together to really answer the question and bring the teams together. Although I guess the federal government has come up with two newer funding strategies that are meant to be multidisciplinary and transcend disciplinary boundaries. So we'll see. I'm new, so I could report back next year to see if they fund any of my One Health programs, but I do think more work should be put in that area.
So actually, I think we've seen that as well. And that's, I know when I started working on research back 20 years ago, collaboration, it was late in your career when you started to collaborate because you knew other people, and there wasn't a lot of collaboration going on. So I've certainly seen a great increase in collaborative projects, and now it's expanding that collaboration to multidisciplinary projects. Mm-hmm. And going specifically to the project you outlined with the regenerative ag, how will you measure your soil health in your study? Do you expect to see a correlation between soil health and AMR?
Yeah, that's a great question. So I am not a soil health expert. If I had my expert here, I would pass it off and let you know. I know she's planning to do measurements probably twice this summer on the farms. They're doing a larger study, and they're going to include ours as part of it. But I'm not exactly sure of the measures, and I'm really sorry. But I promise they are experts in the area. And then correlation between soil health and AMR. We do not AMR specifically, but AMR reaching the environment, yes. We do expect that there'll be greater infiltration in improved soil, so that we will see water being retained and less runoff. So therefore less AMR maybe reaching, say, surface water bodies. That would be part of our hypothesis. So not maybe that direct link that soil health will influence the AMR, but that it might facilitate less movement of AMR in the environment.
Okay, so in that study, you're looking at grass-fed beef. Are there any plans to look into other pasture-raised animals, hogs, chickens? And I was going to say, not in some of the commodity organizations, there's some large farms that don't really have chickens outside, but there are some.
That's a great question. I'm just dipping my toe into this field. So rotationally grazed beef was kind of a first starting point, but I would be definitely interested in expanding to look at different livestock and different practices. My issue is I'm part of this LRIC mentorship program, so I'm getting a quick introduction to the livestock sector, and I don't know as much as I need to know. And so if you're interested in chatting, I see it's a question from Mike, I'd be open to chatting more if you have some ideas on how this research could translate to other producers and other livestock.
All right, we'll put you in contact. So I've got another one here referring to you referred to a Wisconsin study that you were involved in. And Dr. Ed Top from AAFC, he's done something here with the South Nations water in Ontario a few years ago. And he used DNA tracing. And the question is, DNA tracing a tool that you're going to use in the future where we could trace back contamination right back to the farm?
Yeah, I'm guessing Dr. Top used microbial source tracking. So looking at the DNA of the organisms, and I've used some of that in my own work. So we use it particularly for humans. So there's like human Bacteroides is a bacteria unique to the human gut. And we look for the DNA of that organism. And if we find it in the water, we know it's come from a human fecal source. And we can do the same thing for specific animals. And so those are the same types of source trackers that Dr. Borchardt did in his study. He would have looked at bovine Bacteroides and that would have known that it came from those specific sources. But that's a good question, Guy.
Okay, that's good. Do you feel that there's one sector, human, urban, or rural settings, agriculture, horticulture, animal production, that represents a bigger threat or a bigger player in the One Health picture?
I think, I don't know. I think in terms of threat, I do think in One Health, like the focus has largely been on, or in health in general, it's been really on human health. And I think veterinarians, from my experience, are more open to other disciplines, and the medical profession is still rooted in medicine, and they're getting better and better. But I think that barrier needs to be brought down. So I think vets play a big role in pushing the One Health agenda, and I think trying to get that dialogue going. I don't want to like kind of pin one against the other. I'm environmental, so I can be in the middle. But the environment has been left out, largely neglected actually in the One Health piece, like they're kind of focused on these two areas of it. Nobody looks at, well, what's happening in the environment, and are we seeing kind of this increase in antimicrobials, for example, in the environment?
I read a book a number of years ago called Zubequity, I believe it was called. It was written by a medical doctor, and there's a couple chapters in it regarding the fact that human doctors could learn so much from veterinarians. And she was a cardiologist who had gone to a zoo to evaluate an animal and realized, oh my gosh, there is so much stuff that the veterinary community knows, that we've researched on animals that could be applied, but the medical community wasn't looking there for it. So right along to what you said, and it was Zubequity. I can't tell you who the author was, but I'm sure if anybody was interested, Mr. Google could supply the answer. What questions do I have here left? How could sector groups like Dairy Farmers of Ontario, Beef Farmers of Ontario, Ontario Pork, how could they help you tackle your research objectives?
That's a good question. I think having more open dialogue about what One Health means to those producers, and kind of coming up with joint priorities as to how this One Health work is in the best interest of producers, and how we can kind of align those interests to make it so that this doesn't seem like this abstract One Health concept, and kind of unpack it for producers and come up with maybe more best practices, guidance documents, webinars, and then and opening up introductions with producers, with folks like myself on like doing on-farm research. I'm a very applied researcher, and I think it's great for researchers to test things in kind of controlled settings. But at one point, if it's not feasibly can't be done on farm, then what's the point? And so that's partly why I've chosen to work with farmers that are already practicing, to see like, well, what are these farmers doing? Is it already working? Because anecdotally, they think it is. And so I think it's worth exploring. Other things would be to, I guess, support joint initiatives, maybe between the sectors on One Health, and have funding competitions. That might be something that, given this lack of One Health funding available in this space in general. So those are a few things.
Mm-hmm. Something you didn't mention in your talk at all, but I know at the University of Guelph there is a One Health Institute as well. Can you speak to that at all?
Yeah, I'm only newer to the One Health Institute, but they've garnered a lot of attention and interest and have been highlighting different researchers at the University of Guelph working in that space. So I think it is actually a resource for those on the outside to come in and learn about what One Health is, and that it's really extremely interdisciplinary. Like, there's people working on lemurs in Madagascar with livestock and those interactions in One Health, and like things that you would, there's philosophers working in the One Health space and things that you might not even think about. So I think that is a resource, and there's going to be a One Health undergraduate program that is kickstarting next year. So we'll start to train professionals in this more multidisciplinary thinking from the get-go, which I think will be helpful.
Great. And I've got one last question myself, and it comes down to like the waterborne illnesses. Is some of that depending on where you live as well? Because if I go to Mexico and drink the water that I can see other people drinking, they don't get sick, but I will get sick. And
yeah, it's a great question. So there's an element of acquired immunity that people might get so that they become more immune, but they're still getting the organisms. So they're still going to be like infected, and then they're going to shed it, and then it's going to get back in water. So they're going to keep spreading the disease. They might not experience symptoms. It's kind of like COVID, where some people are asymptomatic, but then spread it. The same thing happens with enteric disease. And what we get most worried about is like young children, elderly, immunocompromised, that really can suffer. And then some of these illnesses that we're learning more and more about, that they can lead to like autoimmune diseases and reactive arthritis. You have a bad bout of Campylobacter, and maybe you had diarrhea for a few days, no big deal, but then later on you go on to get some sort of chronic long-term illness. And so the burden of disease could be pretty substantial, but it depends a little bit on where you are. But even if you've got some sort of acquired immunity, you could still have longer term health implications of being reinfected by these organisms.
so a scary world just got scarier.
Sorry.
Anyway, that I don't see any more questions. That I want to thank you very much for your presentation. That we did see some notes on people were very appreciative of what you've shared with them. There's the white paper we have on our website. Our next topic is going to be on genomics. That's going to take place on June the 8th. Now, that's going to take place at 4 o'clock in the afternoon. Part of that is our speaker, our expert that day is Steve Miller, and Steve's in Australia. So we wanted to be kind to him and only have him get up at, I believe that's 7 o'clock in the morning for him. And if we did it at noon, it would be more like 2 o'clock in the morning. So we thought we'd get a better presentation to move it to 4. So you're able to register for that on our website now. This presentation has been recorded, as I said. It will be available early. We may get it on late this week. Well, today's Friday. It'll be on next week. That we will get it on for anybody that wants to go back to reference anything. As always, you can sign up for our newsletter, follow us on Twitter, and Heather, thank you very much for today.
Thanks, Jean.